Hello, I'm Dr. Alan Malik, and welcome to the second webinar in our series on how to set up easy and effective community-wide screening programs. In the second webinar, we're going to get into how do we simplify the screening process. In the first webinar, we kind of talked about, how do you basically expand the capabilities of your programs for greater breadth and reach and connection and engagement. And in that process, you can see that there's a lot to it. And the reality is what you want to do is you want to cross through that over to engaging in that electronic side of things and then let the automation do the work for you. So in the long run, you actually simplify your entire process. So let's get into that a little bit more. The idea here is that you want to make everything simple and easy to implement and maintain. And so obviously the first thing you have to do here is you have to go electronic. And that, could be a hurdle for you. I would hope that in this day and age with cell phones and smartphones and PCs and everybody on the internet and social media and Facebook, this should all be pretty natural for just about everybody at this point in time. And in this early childhood area and so forth, it's actually even more so. What we're seeing in many cases is that, about the only way to get a hold of them is you got to send them a text and with a link in it sort of thing. So you really need to embrace this whole concept of moving into the electronic world. And I don't know how I can help you get any further with that sort of thing, but we'll try to work on it a little bit here. And then once you go electronic, then you start realizing from the social media side of things, you want to connect up. So you want to make connections. You want to share screening results. You want to be able to coordinate care with other agencies. And then, a big piece in this whole thing is just data transparency. If all your information can be centralized and then everybody gets access to it, that transparency really goes a long ways towards getting everybody up to speed and in the program. And then the cool thing about, when you start connecting is that you can start distributing your workload, and we'll get into that whole thing and how that can all help you out and so forth. And ultimately, you're leveraging automation here, and you're using, modern social media sort of and email marketing sort of techniques and so forth. And we kind of refer to this whole process as you're kind of like building a community network. But what it all really comes down to is you just download some apps, you connect, and you start doing your work, and everybody works on their own, and you connect to the level that you need to connect. And so anyway, let's get into it and see where we're at. This big idea of going electronic. And the one thing that goes, essentially unstated but is huge in this whole process is going electronic isn't that big a deal if you have self-report and you are actually going out and having the clients and the parents filling these things out on their own, essentially their own social media devices and so forth, on their tablets, on their smartphones and so forth. But the big thing here is they're doing your data entry for you. And once you get your information electronically, you can do all sorts of stuff with it. And electronic processing, it can be automated. You get rid of tons of error. You can do all sorts of process. You can seamlessly integrate it, like in a medical community where probably the most of your screenings are going to come in when you go community-wide. You can make that all seamless right into the EMR. You can even make it seamless in and out of the EMR. And that's a big deal for medical providers and so forth. They just don't have the time to be messing around with stuff. They definitely don't have time for paper, that's for sure. So you're never going to see anybody going paper inside of a pediatric clinic by choice. So the ideal thing is, when you schedule up on your EMR, that automatically puts you up into a launch queue, and some whatever the designated period of time before the visit, have it send out an email or a text notifying that you need to go fill some stuff out. You get it done or not. If not, then you get some reminders along the way. And if you still don't get it done, then when you show up at the doctor's office, you end up having to fill it out there on a tablet or something local and so forth. Or even on your own smartphone there inside the office, they can redirect to you. But the whole idea is that you're doing the data entry, and then that stuff automatically goes back into the EMR. And it's a seamless integration and automation that just takes all the work out of this thing. If you're truly, fully connected between your EMR, both out and in terms of getting scheduled out and pulling the data back in, the medical provider doesn't even have to dedicate any staff time to it. All they do is when they come in and for the well visit, they basically pull up the child's medical record, and there are the results sitting right there for them. I mean, there's no staff time involved at all. I mean, that's when you get this thing down to the lowest cost possible sort of thing. So anyway, just lots of different reasons why you want to go electronic, but I kind of listed a bunch of them out here. But it's the premise of everything here, and it's a hurdle for a lot of people to think about and so forth. But it's really simple once you do it. It's no different than pulling down an app on your smartphone. The next thing after you get past the idea of electronic, then you need to think of this next level of making connections. And so we kind of make connections on 3 different levels. It's kind of like between agencies and clinics and so forth, but we can also connect between for profiles up into portals, and then you can manage activity inside of portals, and then you can even connect over to personal apps on a profile level, and then you can also use those for care coordination as well. And then finally, there's connection on essentially the overall data transparency level, so like on a program or community level. And then you can make connection over to community resources. You can make connections over to, your early intervention or child find. Ultimately, out of all this, when you make all these connections, there's many advantages here. One is you distribute your workload, which we'll get into more, but you're also able to share your screening results. You can manage flags and referrals in a shared manner. You can basically notify other groups about a flag, get them to handle things on their side, and then close out the flag or the referral and so forth. And then you're also obviously sharing this aggregate data and so forth. And ultimately, all it comes down to is that you're building a network. You basically pull down apps, portals, whatever, get accounts set up, and then you connect. And you can connect on a profile level, you can connect on an agency level, and it's all just, you build things up. So you can start small and just grow the system any way that you want it. This concept of distributing the workload, this is, kind of counterintuitive to what most people are thinking in the industry at this point. Everybody wants to go back to this idea of a central portal, and everybody needs to go back there because, the thought being that local people don't really have that much resource and so forth, and they don't want to get involved with it, so that they'd rather have a central point. And you can go ahead and set up a central point for all of your like your early learning centers and so forth to hook into and so forth. But you're going to find that the majority of people that you're pulling in, you want to be pulling those out of the medical community. You want to be in those medical environments. And in those environments, they do not want anything centralized inside of your portal. They do not want their PHI inside your portal. They want to have potentially a seamless connection to the outside world and into their in and out of their EMR. But they don't have time to be going out and grabbing data, all that kind of stuff. You just can't. You can't really pull that together. It just doesn't make sense in a medical community. So, especially in those situations, you want to just distribute out. Let them run on their own. Centralize the aggregate information so that you guys can pull that together for your data transparency and all that kind of reporting. But, from a workload perspective, move that screening right out into their offices. Move it, let them all work locally. All their data would go back to some central point in terms of the data itself so that you can get access to it. But the whole trick here is let everybody do their own work, and it's business as usual. And that solves the majority of your problems. You can get tremendous reach if you just let people work in their own environments and stop trying to centralize their processing and so forth. So, yeah, we can talk about, let's make a big old central portal for an entire county or for an entire state and so forth idea. Or more realistically, you kind of want to distribute that out and let the individual organizations based on how they want to go about their business. And some may use your central resources, some may not. But typically it's a combination of, and your best way to go is as much stuff as you can distribute out. That's just less cost on you, and which we'll get into more later. So the other thing to think about here is that you can separate functions too. So, you can have screening sites, and so you need to think about portals and personal apps as screening sites because somebody has to follow up on that information. But now basically if you make a profile connection back over to say someplace that can do that care coordination for you. So, take your online portal and push it back to maybe a public health nurse, Or if you have to actually create an entire separate activity around that, you have to hire people for it. Then you're going to run up a bunch of cost around that, but you can do that. But, if you go through a central portal, but, ideally, if you can distribute it out and have different screening sites actually initiate the screenings and do the follow-up on a local level. You can even, in many cases, the early learning centers and the early childhood centers and so forth, they really want to know how to do that. They really want to be trained up on how to do that follow-up and so forth. And in a medical environment, they're going to do it naturally. And so, you can help train them and so forth. But as much as you can, push the care coordination out with the screening and push all that workload off, distribute it out as best you can. And then finally, what's all that's really left is just that data reporting piece. And since you have all the data centralized, basically your program can go in and just, what we've seen in most programs, it's better to do it like once a quarter. But once a quarter, you just pull some reports and you distribute them out, go out and maybe do some TA off of those sorts of things if you want to. But it's, you don't have to, when you start thinking about electronic screening, it's not because you're going to take on the electronic screening. Think about using electronic screening to get the information into an electronic format that you can get access to, but leave the screening process out in the different areas where they actually are going to be doing it and put it under their budgets and so forth. The other thing we keep talking about here, along with distributing that workload, is you want to leverage that automation. And, it's everything from this ability to, say, go from your EMR when someone schedules an appointment to automatically send out. It comes down to setting up screening protocols. So maybe once you get somebody into a protocol, then you know that at 30 months or whatever, you're going to automatically send them some surveys out through a text or an email link and so forth, and notify them that the screening needs to be done, pull the information back in, send reminders if you need to, and so forth. But you can automate that entire process, that whole scheduling process, the actual contact, the actual administration, the pullback of that information. Someone's going to have to follow up on it at some point to take a look at it. But at that point, you should all your detections done, all your activity, all your labor associated with the process is already done. So this basically comes down to, the big thing about doing computed results is it's all error-free. We basically did some head-to-head comparisons back in the early 2000s between paper and electronic up in Minnesota in their Foundations for Success program, and they were seeing actually over 30% error if you just get into how many people got put into the wrong age group, or errors in the calculations and so forth that would be done through the hand calculations and so forth. So doing things manually is very error prone, and those errors then compile themselves into more cost because now you have to follow up on those, or you basically missed information, so you cost to the system because you didn't get it right. So, all those sorts of things go for you. If you can basically set up all of your transactions that you want to do, so maybe you want to move stuff in and out of an EMR, you want to, for an EMR setting, you want to actually make your PHI, all your protected health information automatically come off and go into a safe storage area. They call it safe harbor de-identification and so forth. And then, you can push your data over to data warehouses. You can go to your health information exchanges. I mean, we just implemented a whole program out on the western slope here in Colorado where we're doing their social determinants of health. And when people trigger and then actually say they'd like to be contacted, it automatically goes through the QHN out there and runs over to a caseworker or case manager inside they have a couple of them set up for the entire slope, and people are basically that whole process is automated. There's no delay. There's no getting lost in the process and so forth. It all goes straight through. So what you want to get into are these fully integrated systems and so forth, and leverage automation to the max, and it cuts your costs and just makes everything go faster in real time. And it gets you up onto those platforms, those social media platforms, that you can engage people in a much better manner. In terms of engagement, well, not the provider or parent sort of engagement, but one thing you do find that's kind of interesting is when you set up these community programs, you actually have to have what we term the rules of engagement. And so you have to get into sorts of things where you kind of, essentially, a lot of this is worked out through a roadmap and so forth. But what it comes down to is that you got to come up with rules like, all right, when somebody's screened, a screening site is responsible for managing their follow-ups and generating their flags and so forth. So if someone's going to put up a public portal, then anything that comes to that public portal, they're going to have to make sure that gets followed up on. If somebody distributes personal apps or allows personal apps to connect to their particular organization, then they're responsible for following up on what comes to those personal apps and so forth. And then anything that's done inside their facilities or at their sites or their agencies and so forth, they're responsible for following up on it. Now they can make a connection over to, say, maybe a care coordination group or a call center or something like that. And so then they're responsible for doing the screening in one place and they're doing the follow-up in another place. But you get in this concept of the screening sites versus the care coordination sites, or are they integrated together and so forth. And then moving beyond that, then you can actually even share your flags. You can basically screen out in a early learning center or early childhood center and loop in the primary care doctor over in your patient-centered medical home. You can basically, between the two of you, actually exchange notes and so forth and decide what to do about that flag. And then once you have something been flagged, then somebody can turn around and off of that, basically escalate it, make it essentially launch a referral off of that. So now, based on that original screening and the flag, you turn around and create the referral over to maybe some sort of evaluation sort of thing, like an early intervention sort of thing. And then that person at the early intervention location, the destination there, they can turn around and see what was the flag about, what were the notes exchanged with that, what was the screen, what were the original results, what were the past results for that particular child. They have all this information immediately available to them because they're hooked into the profile now. And so you go from these source and destination sort of things, and you can just continue on. You can go from your evaluation over to your services and hook that whole group in. It all comes down to just making these connections and managing those connections, managing your flags. So it's pretty straightforward. Most of the automation is set up so that you basically all you can do is the appropriate sort of activity, but you kind of have to come up with this idea of, who's going to manage what are the expectations. And then the other thing that, comes out a lot with essentially your roadmap and so forth is you come up with that original protocol. So how often are you going to screen? At what ages? And what are the things you're going to screen for at those given ages? Usually you try to coordinate that all with well visits, which then coordinate over to your immunization schedules. And so you try to keep everybody around the same sort of thing. You get a little bit of an interesting time when, basically the early learning centers and so forth, or the early childhood centers, they're all wanting to do screens around room change and so forth. So it's more of an annual sort of thing. So, it's kind of what makes the most sense in those situations. And what we find in a lot of situations is you can't screen too much. And so if you over-screen, nobody's really worried about it. It's kind of like, okay, that's just more information, or that's good, or we got it from multiple sources. That's a good thing too. So, it comes down to you're just getting everybody on the same page about how you want to handle things. But once you get everybody talking and everybody agreeing on how to handle stuff, then, all of a sudden that reach goes way the heck up. Now you can get out and get to the point where, like we're seeing communities where they're up over 90%. I mean, that's a great number to hit to. To give you an idea what it might look like to screen electronically, the first demo we're going to show here is how to do this in a portal. And so this is actually a managed portal. So you come in with using an email address, and you can have as many profiles as you want set up against that email address, like Billy and Sally here. When you get in the portal, you can see the red is kind of leading you through to the things that need to get done. So in this case, Billy needs to get some screenings done here, and so they're following through. And so they're dropping in here, and basically select your language. And then you're going to drop into, in this case, we're looking for an ASQ3. Now, the nice thing about doing things electronically is that, you're going to do all your calculations for you, so you don't mess those prematurities up or get you in the wrong age group or any of that kind of stuff. And then as you're paging your way through here, it's all screen by screen, single click. It's much easier for people to use. Great for using on mobile devices and so forth. We're actually using shape characters there for audio and so forth. Now, another fun way to do this is to actually go and launch this, say, out to a text, and then just click on a link inside the text, and then you don't have to go through the email and password sort of process. You can just go direct. And so here we are. We're on a smartphone. We basically accept that security phrase to know that we're okay there. We drop in, we just hit our language, and we're off and running. Inside of an agency, the easiest way to do this is that you just, have a single PTI Office app, which allows you to enter stuff on iPads or Androids or even Kindle Fires and so forth. And this is just a manual start. And so you just click it in, you start up with an ID. It looks up based on that ID. If it finds all the PHI associated with that or all the information associated with that, it'll automatically pull it in. If not, you have to enter it like we're doing here, because this is essentially new, but you won't have to do that the next time. Then you select what do you want to do for the screening, and so you can, at this particular age for that screening protocol, you would have had a 1 to 3 or whatever combination of those three that you wanted to go with, and then you're kind of bouncing through. Another way to think about this is if you're doing things inside the office, it's actually even easier than just manually starting them to use the launch mechanism, where before we launched out to a text or out to a portal, now we just launch into an internal device. You pick up the device, you click the launch list, you enter your access code, so staff has some control over it, and then you just select the individual and then start the survey, and then you're in there and running, and once again you're running internally. The nice thing about doing them on the local devices, you can actually use that audio. You can go to other languages for the audio. So we do like English, Spanish, Hmong, and Somali for ASQ3, and we've got other languages coming out here soon. And then you're in and you're just operating. And so in this case, we're on an iPad versus an Android, but it doesn't really matter what kind of device you're using locally. And you can pop right through. And we went straight to the end here just to show how that goes through. Automatically processes, and then you can be pushed out to print station or out to your EMR or into even a data warehouse on the information and so forth. And so another tool that's really useful is to have a front desk, and this front desk is actually running in a portal, so you can access it from anywhere. And a lot of people that are running in this mode like to go to the screening list first, and it basically summarizes, gives you in reverse chronological order all the screenings that have come into your agency or practice. And you can go in and look at the summary data, or you can go in and look at the full report by clicking through on the view, and you get the full trended information, whatever's going on. And off of this, then you can actually get into, if you click through, you can get to the details. And so then you can see, well, in this case, there wasn't other details. So let's go ahead and look up another profile and kind of show, it's real easy with a couple characters. You can find all the people that are even close to what you're looking for. And then you just select them off. And now when you go into your details, you can see all the previous screenings. You can see all the flags that were generated from those, any referrals that were generated off of those flags and were pushed out. And you can actually manage all those on this individual profile detail for that individual. And so here's like a closed out flag that got pushed through. You can reopen that back up if you wanted to. You can go through and look at your current, basically any flag can then be escalated up to a referral. And so in the referral, you can go out for evaluation, or you could go for services, or even the evaluation site could turn around and create another referral over for services. But you can see all the different flags and referrals associated with a given, basically a given screening that raised a flag. And then you can, you have a complete way to track back status changes, notes. It gives you the full capability there. And this view is more like for a call center sort of thing, which is now you get all your information on your flags and referrals summarized together for your agency. And so in a call center setting, you might actually even have these assigned to a particular person to follow up on, like a case manager. And you can filter through and find those. Everything is based on notified date, and you can follow through. So then once you have all this connected up and you have all the screening done and all this follow-up done and so forth, now you can turn around and, since all this information is actually pulled together and it's de-identified back at a central point, now you can run aggregate information off of that de-identified information. And that creates all this data transparency. And so transparency goes towards your performance monitoring, which then you can feed back, which we talked about in the first webinar. You can feed that back in technical assistance. You can send it out through marketing. You can create educational material off of it. You can use that to help market your program, get it going better. Also, data is really effective the next time you want to write a grant, or anytime you want to dig in and try to do some population management on your groups and so forth. That data, getting access to that data is highly effective for system management. And I just can't tell you, I mean, just even everybody wanting to be part of the program, to actually have membership from the marketing perspective of their own organizations. You want to be able to say that you're part of the program, or, basically you're going to lose clients over it. And so it's, once you get people hooked into this whole concept of we're going to share, we're going to take this on as a community, you get that identity going and so forth. It's a very powerful tool for getting people to work together and to get that reach that you're trying to get to. If you've managed to get your workload distributed properly, all you really need to do at that point is just manage your results. And you can drop into a simple dashboard that can give you individual results if you're at that practice, or you can get overall results for any group of people that you want to connect together. So if we drop into the overall results, and this is just a simple display of frequency tables that we can break down. I mean, if you have multiple practices, you could put them in there. You could break them down by quarter. You could break them down however, whatever filters you want to set on the top of this. And when you pull up your data, you can automatically compute graphs and tables and pull out your results for you. You can even just copy this right out and drop it directly into reports that you want to send out. So it's all, once you have your data inside the system, it all becomes very, very simple in terms of being able to manage. In just a few clicks more, you're actually at the point of being able to see your aggregate data and use it. As we've been talking about here, I mean, the way to get everything simplified is to go to this concept of building a community network. And in that environment, basically, you kind of think about it in terms of screenings being done at screening sites. You think of care coordination mostly being done at the screening sites, but in many cases you can break that off, and so you have care coordination sites. It gets expensive when you create a call center, but in some situations you need that. The better situation is if you can basically pull some time off of a public health nurse or something like that in a public health setting to do some of that care coordination. And then the data reporting, there really isn't much to it. You click a couple buttons and gen some reports, and then it's more of just following up with people. But that's where you can manage your programs and keep everybody on track. And it leads to all sorts of capabilities and gives you tremendous management control over what's going on with your program. But, the big thing in all this is that, it's just a download and connect, and then you just start small and build your way out. So you don't have to build the entire program at once. You can basically start out with a single screening site. You can sit back and say, oh, okay, well, let's just start adding, we got another screening site over here, or we're going to basically take this screening site and get them connected up to our evaluation group over in the early intervention side of things. I mean, it doesn't have to be a big thing. And then as you build momentum and build the program up, just more people hook in, your data becomes better, your control over the process becomes better, and you're becoming more effective in creating better capabilities. And your costs are not any different than what you have right now, and you're able to do way more with the whole process. Wanted to get into a little bit of a case study, kind of give people a little bit of an idea how we've been doing some of this stuff. Up in Minnesota, we ended up doing, actually way early on, we ended up doing a bunch of Foundations for Success work, which got us a lot of background in other areas and so forth. But more recently, we've done a Race to the Top sort of challenge grant concept. And so they went out and went into public health organizations, into schools, into medical clinics and so forth. And they basically kind of gave them seed money and said, we need this, to get your program going and so forth. And then the idea is that those programs then are standing on their own when they're done. And that's kind of where we're at with those groups. Now that we know more about the process and so forth, we can actually set it up better and so forth. But those, once those screening becomes part of those programs, you're able to always pull that information together. Even, after the grant has gone away, you still got these programs working together. And then the other thing we're getting into up there is we're actually hooking into their follow along program, and essentially it goes through all the public health in each county up there. And what they've been doing in the past is they have a system, it's probably 20 some years old, where they're sending out they're sending out regular mail and mailing out questionnaires and expecting, trying to get results back in, and they're managing this whole process on an individual basis. And what we've been doing with them is we've been converting that over so that they can essentially send an email from inside of their FAP system out, get somebody to go take this survey online and have it automatically come back into their FAP system. And so that just takes all the labor out of it, and it demonstrates this concept of automating your process. And it also reduces cost. I mean, just the postage and the cost of the paper and so forth. You lose all that sort of stuff, and you flip everything over to email. And the next thing we're looking for to do with those folks is try to get them over on text or out onto personal apps and so forth. And it's basically automation and simplifying and just taking systems that exist, even if they're paper-based, and moving them forward into this electronic world and era and so forth. And it's labor-saving, cost-saving, expands capabilities, expands that reach, extends everything. And so it's just kind of the way that technology is going and what you can do in this world. So that kind of gives you an overview of how might automate, how you might use electronic to solve a bunch of problems for you. You're going to be able to expand that reach. You're going to be able to since expand the breadth of what you're working on. You can make all these connections. You can get better control over your process. And you automate everything. So you actually reduce your labor costs. You reduce your actually hard costs in terms of paper and so forth. And so we'll get all into this all more here, because one of the concepts that we'll get here when we start making the business case is think about the fact that when you distributed that workload out to everybody, you can also distribute out all your cost. And when you do that, you just simplify the whole thing dramatically and really reduce your footprint. So look at the links below, leave some comments. You should find the link to go over to webinar 3 down there, and we'll talk to you then. Thank you very much for your time.